Hello dear patients. Today we are going to discuss a young man with seborrheic dermatitis who came to our clinic. For several years already he had been suffering with this disease. When a diagnosis of seborrheic dermatitis is set, most commonly sulphur-salicylic or hormonal ointments are prescribed. The changes are on facial skin, where the hormonal ointments should not be prescribed for use. You can watch a separate, more detailed video about treatment of seborrheic dermatitis on our channel. We have several of such videos. What was done for this patient? First of all, he had already done a lot of analyses, including biochemistry and others. Scraping and culture tests for fungi were taken, as peeling was quite strong, and secondly, culture test from these scales. Thirdly, immunogram and general blood analysis was taken that were not taken before. So, sodium thiosulfate and calcium gluconate were prescribed for the patient. Externally, cold compresses were first prescribed. What was noted then after the results were received? Firstly, in culture test for fungi, candida albicans were found in high concentration. Secondly, in culture test for bacteria, propionibacteria acne were found. Even though the patient did not have acne, he still had bacteria characteristic for acne. On immunogram, a severe complex disorder of immunity was found. That is, the links that have to be emphasized in treatment were found. If possible, it's necessary to decrease the concentration of candida and propionibacteria acne. By the way, propionibacteria were already insensitive to many antibiotics, but they were sensitive to clindamycin, which is quite a rarely used medication. So what was done? Gradually, first ketoconazole was prescribed externally, in the form of shampoo, in the form of external medications, and in the form of tablets. Then clindamycin was prescribed in order not to overload the liver. Heptral was also prescribed for liver, considering its supportive capacity. Ozone was also prescribed, and immunologist prescribed his additional medications. As a result of that, the best effect was achieved by clindamycin and ketoconazole. Probably multiplication of these candida and propionibacteria facilitated the atypical course for this patient. Rashes resolved almost completely, and the following management was aimed at support of rashes absence by corrections of immune disorder. So, during any skin diseases, it has to be remembered that not only blood analysis, biochemistry and others are important, with which the patient already came, but analysis from the skin itself, which was quite important in our case as well. If it is necessary to diagnose and treat different skin diseases, you can consult dermatologists of our paid medical center of Dermatov Neurologic Dispensary in Moscow. We have experienced specialists who do diagnostics and treatment of different skin diseases. We are waiting for you in our clinic. Please subscribe to our channels on YouTube and Instagram. Thank you for your attention.